Thank you all for coming out today. For those of you joining us via Facebook Live or via Microsoft Teams webinar, this feed is coming to you from the Capital Hilton in Washington, D.C., and we've got a great crowd here. Thank you all for coming out in what looks like to be a rainy day. I want to cover a couple housekeeping items here for those in attendance as well as those joining us virtually. Proper coughing and sneezing technique. Your elbow is better than your hand. If you're greeting someone, it's great to greet them with a nod or with a touch of the elbow. It is still cold and flu season, and we are conscious of concerns about the coronavirus. Everyone should have received an AFSPA hand sanitizer when they came in. If you need more, they are outside on the registration table. Restrooms for those here in person are out this door on the right, on my right, your left. Down the hall, ladies then to the left, gentlemen to the right. In the event of an emergency, please remain calm, proceed out any of the doors that you see and follow the lighted exit signs. There are staircases that will take you to the ground floor to your left as well as to your right. For those of you joining virtually, if something does go wrong with either the Facebook Live feed or the webinar, please check our Facebook page, AFSPA Cares on Facebook, for the latest updates, and we'll get things rolling again as soon as possible. If those of you who are here in person have questions about specific claims or personal issues with your Foreign Service Benefit Plan coverage, out the doors to your right, you will find health benefits officers who are set up for privacy to discuss your individual questions. And for anyone who has to leave early, either the virtual session or in person, we will be posting the entire presentation on our website later this month, and we'll be sure and let all members know when that's available. There will be a mini health fair, as I mentioned, afterward, starting around 12:30, and we'll have about an hour to meet with vendors who are here from Trestle Tree, Carrington, Dominion National, Livongo, Prudential, and our partners from Express Scripts and Aetna, as well as experts in Medicare and our ancillary insurance programs and the Foreign Service Benefit Plan. We've got a full program today, so I'm going to finish my housekeeping items now, and I'm going to invite the chairman of the AFSPA board, the Honorable Thomas Tracy, to come forward. A little bit of background on Mr. Tracy. He joined the Foreign Service in 1960 and was one of the first members of the Foreign Service Benefit Plan when it came into the Federal Employee Health Benefits Program. Tours took him to Mexico, London, Brussels, Moscow, Bonn, as well as assignments in New York and Washington. He ended his career, capped off his career with the Foreign Service with 5 years as Assistant Secretary for Administration, and then he followed that up with 15 years as Chief of Administration at the Pan American Health Organization. He joined the AFSPA board in 1988 and became our chairman in 2006. In addition to his service on the AFSPA board, he also serves as the secretary and treasurer of the Senior Living Foundation, which we'll talk a little bit about later this morning. Mr. Tracy.
Thank you, and thank you for coming out today. On behalf of the Board of Directors of the Foreign Service Protective Association and the staff, I'd like to welcome you to this meeting. We in the Foreign Service Protective Association are trying to make every effort to find ways to help people control and take charge of their own health issues. As many of you know, a lot of chronic diseases involve either high blood pressure, high glucose, high cholesterol. These are all management problems. There's medicines to deal with this. So the board has asked the staff to put together in a sort of from a jigsaw puzzle of what we've been providing to show all of the services that are available to the members of the organization. The Foreign Service Plan is just that. It's there to support the Foreign Service. It's there to support our colleagues overseas. As I'm sure many of you know who served in the Foreign Service, the service today is a lot tougher than when we were in the Foreign Service. There's a lot more separation of families, there's a lot more danger posts, and there are a lot more problems with putting these posts up. So with that, I welcome you and thank you for coming, and I will turn it over to Paula, who, or maybe it's Kyle. He's the master of ceremonies. Thank you so much.
Thank you, Mr. Tracy. In addition to Mr. Tracy, we do have two other board members here. David Witten and Chuck McCarter are both here. And we're very glad to have them. If you have complaints, they are the people that you need to see. Happy to hand out their email addresses for those of you joining. No, I'm kidding. As Mr. Tracy mentioned, our next speaker is Paula Jacob. Paula joined AFSPA in 1988 and has been innovating our different plans and growing the organization since that time. She became the Chief Executive Officer and the Executive Vice President of AFSPA in 2009. During her tenure, she has overseen tremendous growth in membership, the move of the Foreign Service Benefit Plan to a self-insured plan, the creation of the Immediate Benefit Plan, and the development of the Senior Living Foundation, of which she serves as Executive Director, into a bedrock of support for the Foreign Service community. She's a graduate of Creighton University, a registered health underwriter, and is a recognized subject matter expert in federal health benefits by the Foreign Service Institute, where she also serves on the adjunct faculty. Please join me in welcoming Paula.
Good morning. There we go. I don't like a leash. So welcome, thank you for coming. I do want to make a little bit of clarification from Kyle's remarks. If you have compliments, please go to the board members. If you have complaints, please come to us. Just kidding, just kidding. Okay. So I'm delighted to give you a report. Come on in. I'm delighted to give you a report of our activities over the last year. It has been a really busy year for the American Foreign Service Protective Association, and in particularly the Foreign Service Benefit Plan. So for open season, we processed 2,900 transactions. Now open season, remember, lasts 4 weeks. In those 4 weeks, we gained almost 1,900 new enrollees and only had a little under 600 terminations, which is the normal attrition rate. So our total enrollment for the Foreign Service Benefit Plan is over 34,000. And that means that our membership is over 82,000. That means that there are 82,000 of you out there who rely on us every single day to provide you adequate and excellent, hopefully excellent healthcare benefits as you go through your health journey. So we're really proud of that growth. Now growth equals claims volume, and last year this plan paid over $356 million in claims last year. Total, we handled 1.2 million claims, and it's interesting to note that over 67% of those claims were electronic. So you're using what is provided under the portal. Our operational results, Aetna is our administrator, and they have handled all of those claims at an accuracy rate of over 99%. And over 90% of those were processed in 15 calendar days. And that includes the over 100,000 claims we received from overseas in all the different languages and currencies. So thank you very much, Aetna, for your hard work on that. Our performance results in our headquarters, we took over 125,000 calls, and we responded to over 18,000 emails, and our average response time to those emails was about 3 business days. We are improving over 2018. Keeping up with that growth is a continuing challenge for us, but it's a good challenge to have as long as we identify that and do something about it. So last year we did hire several new health benefits officers joined us throughout 2019. That began mid-year, and the effect on our call and our service time was immediate with the decrease of hold times. So far this year, our average speed of answer is now 6 seconds. Our average hold time is about 35 seconds. Little bit of improvement over the last year during my migration when your average hold time was, it's a nightmare. I don't want to remember that. So we are trying every day to improve on that and provide the excellent service that our members expect from us every day. As far as your prescription benefits, last year, Express Scripts filled over 880,000 prescriptions. Last year, total lot, we paid over $80 million in prescription benefits, and the plan pays about 86% of your prescription costs overall. So for Express Scripts, where are you? Where's Odd? Thank you very much for all you do. So I want to go over, you've heard in the news some of the mergers that have happened over the last year that have been finalized. And you may be wondering how it affects you and how it affects us. So I want to talk about those two major mergers. So Aetna and CVS merged. CVS purchased Aetna as a separate business. There's going to be little, if any, immediate change. Haven't seen any yet. The same team will serve as the management team, the clinical team, and the team that processes your claims in Gastonia, North Carolina, will continue to process your claims today. Now, this team from Gastonia worked for us when we were with Mutual of Omaha. So they kind of know us, and they do a really good job. So you have two really complementary companies that have merged together and combined their strengths. I'm very excited about this merger, and one of the things that I am most excited about with this, especially this Aetna CVS merger, is the CVS Health Hubs that are coming our way very soon. Couldn't be soon enough for my taste. Now, I had the occasion to visit one of these health hubs in Houston, Texas, believe it or not. So these locations are going to function as a community-based health hub. What does that mean? That means that there is going to be staff right there in the CVS pharmacy to answer your questions, to help manage your health. There's going to be professionals there like certified dietitians, certified durable medical equipment experts that are right there on duty for you, educational classes, weight management classes, diabetes classes. And in many of them, there's going to be free, and I underline free, fitness classes for yoga and Zumba. Can you imagine that? It's going to be terrific. And of course, they're going to do that thing that they do, provide prescriptions. But all of this is trying to bring healthcare closer. It's going to be about 1,500 of them over the U.S. Many of them will open in this area within the next couple of months. They say March of 2020. Let's give it a little while. But these are the towns that you should look for them. And I'm just really excited by that. I went in there thinking that it was going to be like one of those mini clinics on steroids. It was so much more than that. So these are a few pictures, and you walk in there and you're greeted by somebody. Of course, I have to admit they knew we were coming. So it was kind of nice, but it's a whole new feel in healthcare. This is not to take the place of your provider, but it is to really help you after that provider visit. If you have questions, if, for example, maybe you need a CPAP machine. You've been diagnosed with sleep apnea. You need a CPAP machine. Well, which one? How do you put it on? How do you clean it? Things like that. You've got a professional right there waiting to help you through it. Durable medical equipment expert. And I thought, well, what is that? Well, when you look at crutches, walkers, is it the right height for me? How do I adjust it? Things like that. So this is really going to, I think, change the way healthcare is delivered and really try to bring more support into your community. And that's what we really need. We want to be able to provide the healthcare that you need where you are. So I'm very excited about the CVS Health Hubs. So let's talk about the next major merger, which is the Express Scripts Cigna merger. Now, remember, these are companies that are in different fields. They were never competitors. They are complementary companies again, and that is the way the operations will remain. They were neither Express Scripts nor Cigna was a bricks and mortar company. They provided benefits. ESI has been building technological capacities and capabilities for several years, and we have seen it in what we're able to provide you and the analysis and the data that they provide so that we can provide you with the best possible prescription benefits out there. Their strength really does lie in bringing medicine closer to the individual. And their support for overseas members, I would have to say, is second to none. We are very, very pleased with how they support the overseas members. So when you look back, when I think about this, and I thought it might keep me up at night, how do we handle all of these different companies? But I step back and I imagine the possibilities. We now have we can leverage the resources and knowledge and expertise of two of the largest and most influential healthcare companies in this entire country. So we are really looking forward to working with both companies and with innovative ideas and services that will benefit you on your health journey. This all boils down to what Mr. Tracy was talking about, is really looking at you as an individual and trying to find ways to provide you, the patient, with the personal support that you need individually. And that is what the Foreign Service Benefit Plan has been working towards for the past several years, is the right intervention and the right support programs for you as an individual patient. And for those of you who've been with us for a while, you know you're not just a number to us. You are a valuable member and a valuable patient if you need the health care. So let's talk about where to start. Where do we start on your personal health journey? And I would say that where you start is the health risk assessment. Lots of different ways to take it. It identifies where you are in your journey, and it identifies your health risks. It can provide you with a personalized health summary so you know exactly where you are and what you might need to work on. And if you are armed with that information, then we can work together to choose the programs that work best for you and meet your individual needs. That's part of a very important part of where to start in your health journey. And then the biometric screening, where it measures your cholesterol levels and triglycerides. It's a lab test, blood pressure, waist circumference. I don't like that one so much, but I have to put it in there because it's required. But what they really want to know, what you really want to know, and what we really want to know is, are you really healthy? I mean, how healthy are you, and where do we need to work together? What do we need to do to get you to where you want to be, whatever you define as healthy, because it means very different things to different people. So we still have the simple steps in living well together that we encourage you, meaning we pay you, to really look at things and take those healthy actions that are necessary. Your money goes into the money you earn goes into a wellness fund, and you can use that fund for deductibles and copays, dental and vision things, out-of-pocket expenses, even allergies and sinus medications, first aid creams, things like that, all those over-the-counter things. And it is evolving. This is an evolving benefit. We look at it every year. We are looking at changing it again next year to expand it. But there's going to be a rep in, where is the rep here? Okay, who will talk to you and maybe get you started working through these steps, in these simple steps to living well. And I encourage you to talk to them and see where we can help you. For those of us who have chronic conditions, and most of us will have some sort of chronic condition in our lifetime, we want to provide you the type of support when you need it and how you need it. And what does that look like? Well, we have specific programs for case management. If you have diabetes, high blood pressure, pain management, we have individual programs for that. If you just want to talk to a coach, you're not sure where you are, maybe you don't have that type of condition, but you just want to look at things and see what you need to do to improve your health. We have different types of coaching. We have one-on-one telephonic coaching and digital coaching. And those are things that are available to you at no cost because it's in your health plan. If you're with somebody who likes computers and works and prefers that, you can do the digital platform. We have a lot of member engagement through the portals. There'll be some demos in that. We have interactive apps that you can download. We want to support you where you are. And this has been a continual theme for us for the last several years, because you guys are everywhere. And that's where we need to be. Virtually. Pharmacy support, and I think that this is really a less well-known and underutilized benefit that we have. We have Express Scripts that doesn't just fill prescriptions. You have access to a personal medication coach. You have access to specialist pharmacists that are trained and educated in your condition, whether it is neurology or blood pressure or gastroenterology, your digestion, whatever. They are specialists in that field regarding prescriptions. If you are on one of those specialty medications that are those those biologic medications, those are really tough. They're confusing, they're scary. You don't know exactly how to take them if they're not in pill form. What are the side effects? You know, you have specialty nurses that are there for you. We have a specific pharmacy that will help you and support you, all free. And you also have access to medication pricing, where you know what your medication cost is going to be before you walk into that retail store. Or if you are on a maintenance drug and you are looking at it and taking it through the home delivery program, you can price it and see what is better, if it's this preferred brand name, or how much would I save if I went to a generic. So we have lots of different touch points for you to help you make decisions on your health care. And here's some examples of support that we provide that you may not know of. Aetna has what we call an in-touch care program. And this is the nurse that is assigned to you as an individual and will remain with you as long as you need that nurse. Now imagine that. Just the ability to call a nurse up and talk to that nurse. One-on-one, continuous support, able to answer questions. Maybe the doctor said something you didn't quite understand because you know your 7 minutes is up, out. Next patient, right? Then what do? You still have questions? Well, you call us. That's what we're here for. They've even added things like a social work program, and you're thinking, why do I need a social worker? Right? Well, if you've ever been discharged from a hospital, you know what they want to do? They just want you out. They want that bed turned over. Okay, so you get these written prescriptions and you get these written orders, and they'll say, okay, hop in the wheelchair, right? And then what do? Well, if you have that social worker, that will work with the discharge planner with the hospital, you're covered. So you come home, everything's okay for you. You know what you got, you know what you have to do, everything is prepared for you. Let us worry about the preparations, right, Kelly? Kelly? You worry about getting better. Deal? So, compassionate care program is a support when you're facing advanced illness or an imminent end of life, and that is a tough situation. You are a family member, and decisions that have to be made. Maybe they're your decisions that your family member doesn't quite like. Some of us have been there. How do we cope with that? Well, you have the support. And one of the things that I'm really fond of is the pain management program. Now, we developed this with them because of the opioid epidemic several years ago. And we've developed this program to support you when you're facing chronic pain, or if you have an opioids dependency. And we explore different treatment modalities, not necessarily pharmacologic. And you've got a nurse right there, a professional right there to walk you through it. This is a lot of information. I realize that, which is why I have Kelly there. So please go to the table and talk to them about what we can do with this support program. So this is just one of the examples of support that you have at your beck and call, at your fingertips. Everybody's heard a lot about this new telehealth program. It's in the news, and the younger generation is all over it. As a matter of fact, most of them only use this type of healthcare, where you're going to telehealth. And this is a way that you can talk to a provider immediately from your home using your computer, tablet, or phone. It's right there. It's Sunday night. You twisted your ankle, or you've got a sore throat and you don't know what's going on, or your child has a sore throat, whatever. Do I go to the doctor? Do I go to the emergency room? How serious is it? Well, you have a telehealth appointment, and it's really nice. You have access to a doctor. No, you don't have to wait 2 hours at the emergency room. No, you don't have to wait to see if your doctor can see you on Monday afternoon. Your average wait time for that appointment is maybe 4 minutes. Kind of nice, huh? Doctor sees you, talks to you, can prescribe medication if necessary, and you're done. And what it costs to you? Nothing. So you're writing that down, right? It is really it's really the way that medicine is going. Again, meeting you where you are. You need health care where you are. So we are really excited. This is about the third year that we have sponsored this type of a program, and it is growing in popularity because people are finally getting it. You know, this is not the nurse line, though we do have a nurse line. These are real physicians talking about real diagnoses. And one of my favorites is of our support programs is the Livongo program. Now, this is the remote program for diabetes and blood pressure, and now they have a weight management program as well. I looked at this, and we put this in a couple of years ago for the diabetes program, for the person with diabetes. You get your monitor, you get your test strips, all of that. Within 2 months of our offering this, we had a 27% participation rate, which, by the way, is unheard of. Most of those were overseas too, that they could handle. It was really amazing. Support, advice, people watching out for you, no matter where you are, no matter what you're doing. And we have a rep out there, where are you? Right there, to talk to you about this fantastic program, which has been just a huge success for our members. So if you are interested in that program, please go see Jennifer, and she'll be happy to talk to you about the success of the program. Some other examples of our support programs, and I could go on all day. How much time do you have? Just kidding. Oh, good, good. Okay. Things can get really technical and really scary if you are faced with a diagnosis of a serious health condition. And things in medicine, it changes not monthly, but daily now. And it is impossible for, as good as your primary care physician is, or as good as your specialist is, it is impossible for that physician to keep up with the changing healthcare situation, all the changing the changing modalities of treatment and care programs and support programs and treatment plans. So we have a couple of things available to that individual. Pinnacle Care is one of our newest. Pinnacle Care is an independent support company that they have access to the best providers in the country. They have the data. If you come to them, come through our care managers with a specific condition that qualifies for this program, a serious condition, they will look at your records, they will make sure that it is on the right track and that doctor has all the latest data. And if they say, for example, yes, you have this condition, this sounds like a good treatment plan, let's talk about the best provider and the best hospital in this country that can treat you. It may not be your community doctor. It may not be your community hospital. I'm not really sure. As much as I'd like my community hospital, I'd want them doing a kidney transplant on me. So you think about that. Well, Dana-Farber may have the best in that specific field. You want to go to Dana-Farber? Okay, they can make the appointment usually within 2 weeks, not months. Imagine that. Isn't that cool? So hopefully not a lot of people need to use this, because I don't want you sick, I want you healthy. But if you do, they're there for you. And the good thing about this is that we're not guiding your care, they are. They're independent and they know almost everything there is to know about the changing atmosphere and the changing landscape of medicine. For those people who are overseas, we have a very similar program through Cleveland Clinic. I think you've probably heard of Cleveland Clinic. It's that small company in Ohio. Yeah, we've had a wonderful relationship. Actually, and we work very closely with the Bureau of Medical Services at the department on this for our overseas patients, which really operates in a very similar way to Pinnacle Care. So that's on the other side of the spectrum with the really serious conditions. So in summary, the benefits that the Foreign Service Benefit Plan offer, I would argue, and probably I'll get in trouble for this, it's really superior to any other FEHB plan. Is there anybody from OPM here? Because I know one of you came from OPM, just not admitting it. Okay. Our the In-Touch Care program with the social worker and the management programs are really, really helpful. Medical services and supplies, the Quest Diagnostic Outpatient Lab where you pay nothing for your labs, the adult hearing aids and devices, and even the foot or orthotic devices are available to you. Kind of strange, but they all are available to you. We do excel in our alternative treatments, our chiropractic benefits, our acupuncture. Has anybody heard we offer massage therapy? Yeah. Just wondering. Very, very popular program. And let's not forget some of the special programs that you may not be aware of. The diabetic education program. We have a specific cancer support program. And also, believe it or not, we have a therapies cuisine program, and you wonder, what is that? That is a program designed for patients with cancer who have problems eating. And a lot of people do, right? So this program is really helpful in providing you the support and the advice you need if you are in that situation. Cancer's not fun on the best days, but you know, you got to eat. So it is a really important program, and you may not even have realized that it's available. So, but we got it. So some of the tidbits that I would like to talk about, besides now that I'm done with the benefits, I want to clarify a few things that we get questions on throughout the year. So a couple of years ago, we put in the Smart 90 program at retail pharmacies that included Walgreens and certain independent pharmacies. This was put in for your maintenance medications because the only way you could get them beforehand is through Express Scripts home delivery service. Some of you don't want to go through home delivery. Sorry, Mirzad. Nothing personal. You want to go to a pharmacy. You want to talk to that pharmacist. So we finally got Express Scripts to go and talk to the manufacturers of the drugs and agree to provide the discounts that we get from home delivery to Walgreens. Why was that so important? Because if we didn't have that, we would have to charge you more for your 90-day supply of drugs. But they finally did it, thank you. So you were able to get your maintenance medications. I'm not talking about antibiotics. I'm talking about the ones we take every day at Walgreens. So I looked at this, and a lot of people don't want to go to Walgreens. They want to go to CVS. So I said, go back, see if CVS will match their discounts, which they did. So we were able this year to add CVS pharmacies into the Smart 90 retail stores. Now let me clarify. These are not the only stores that you can get your prescriptions at. There are thousands of participating retail pharmacies that participate with the Express Scripts program. Those are meant for your 30-day supply of medication. All right, you can go to thousands of pharmacies. What I'm talking about is your maintenance medications, the 90-day supply. Now you have 3 different ways. You can mail them in to home delivery, like many of us do. You can take that 90-day prescription and take it to a Walgreens. And now you can take that 90-day prescription and take it to CVS. It is your choice. Okay. And you pay the same, which was my concern, because they didn't want you paying anymore, and I didn't want to pay anymore, because the more we pay, the more you pay. All right, a couple of other things. Massage therapy claims. There is a special handling requirement, but they do not require a CPT code, although there is a CPT code for massage therapy. We don't need it. You can file your massage therapy claims directly with us. Please look on our website because we do need specific information for those massage therapy claims, and then we will pay them. But you do not have to provide all those fancy codes. Most of the therapists don't know them anyway, so we got you. Next thing is chiropractic claims. Now, many of you go to chiropractor, and some of you have Medicare Part B, right? Medicare Part B actually pays for chiropractic. Not as much as we do, but they still pay. Because of that, you've got to file the claim with Medicare first, because we can't pay it until we know the Medicare payment. Now, once we see, after you've gone to the chiropractors a few times, and Medicare says, okay, you're done for the year, you have maxed out, and we see that, okay, and then we're okay. But until then, we have to have that Medicare statement in order for us to pay your chiropractic claims. And this only applies to those of you who have Medicare Part B. It does not apply to those of you who don't. Okay, next thing is a majority of our reimbursements now, believe it or not, are made through electronic funds transfer and goes directly to your bank account. It is a very popular program. It is very popular overseas and growing here in the States. We finally got an fillable form that you can do online. It is much simpler now. So if that has been what is holding you back to get your claim, your payments delivered right into your bank account, we made that step a little easier. Please go ahead and go to our website, and if you're interested, fill it out, and you will love being able to get your money a lot faster. Another thing I want to talk about is the HIPAA 3 form. People ask what that is. Okay, so here's the thing. You know that little thing called the Health Insurance Portability and Privacy and Portability Act. Okay. If you call our team in DC on L Street and you are a spouse or a sister or a daughter, whatever, and you ask us information about a claim, we can't talk to you. We can only talk to the individual member unless we have one of these HIPAA 3 forms on file. It is against law. It's not just us, it's everybody. So if you want us to be able to talk to your designee, whether it's your spouse, your sister, your daughter, your son, whatever, either fill out the HIPAA 3 form and we have them over here for you, or provide a power of attorney. Because we're just not allowed to. Don't be mad at us, be mad at the HIPAA Act. So, but we are, I just wanted to explain that and give you the opportunity to file it. Everybody should have a designee in case something happens. Last thing, some of you may have received what OPM calls a Member Satisfaction and Experience Survey. They went out a couple of weeks ago. If you received them, please fill it out. Let me clarify that. If you receive them and like us, please fill it out. If you receive them and don't like us, don't fill it out, call us. No, I'm just kidding. It is really very important. This is important information for us. OPM sees it, we see it, we need to know what your experience is. And as much as I would like to meet with each and every one of my 83,000 members, I can't. So this is a way that we know what you're thinking and where we can improve, or the specific things that you like, especially that. So if you get one of them, please fill it out. Don't throw it away. And I know it's one more survey and everybody is really sick of surveys, and I know that. But I'm asking for a favor. If you get it, fill it out. Okay, real quickly, some of our ancillary insurance programs. AFSPA has really grown and excelled in this area. We don't just handle the Foreign Service Benefit Plan, although it's very near and dear to our hearts. Sorry about that. We actually have 3 life insurance plans, 4 dental plans, 2 disability plans. We have member of household plans, so if you're taking a family member overseas that does not have insurance that works overseas, like Medicare, you can actually have them insured. Long-term care planning, we have attorneys that are available to you at discounted rates. We have financial planning, travel assistance, and also tax consultant services. All of those are available to you through our ancillary insurance programs. And where are you? There you are, over there and over there. Oh my goodness. Okay, there you are. So talk to them about those. A couple of other things are discount care programs for dental, vision, and LASIK. We put that into place. How many of you hate dental insurance? I'm sorry. You didn't think I was going to say that, right? Sorry. Maybe you don't want that much coverage. Now, most of us, sorry, Sherry, most of us want dental insurance. But if you don't, but you still want that protection, you've got it in a discount program. They're out there. Where are you? Carrington? There you are. Okay, talk to them about that. A very popular program is our True Hearing program. This is for your hearing aids. You can use it in combination with the Foreign Service Benefit Plan. It is going to provide huge discounts for your hearing aids. And I am not talking, I have to address this ad that came out on the news about one of the hearing aids that the Federal Employees Health Benefits Program covers. I'm not talking about that. What I'm talking about, state-of-the-art, real hearing aids. So you may want to look at that and talk to Carrington that can give you more information about that. I'm going to get in trouble, right? Okay. Oh, they can talk to Kyle. Oh, why can they talk to you, Kyle? Why can't? Because I can't say it. You have to say it.
I was one of our first
he was our guinea pig.
Yes.
All right. A couple things that we're working on, because we don't just sit there and talk about all the good stuff we've done, except here. We are looking at a couple of new programs that we're very excited about for next year. One of them is the critical illness program that we're working with our partners at Prudential, and this is coverage for really serious cancers, heart attacks, organ transplants, and it gives you money to help pay for things that your insurance does not pay for, that you wouldn't even think of, like things like mortgage, rent, even childcare, things like that. That extra little bit of support that you might need. So we're coming out with that. And another thing that we are looking at and coming out with, and I'm kind of excited about this, is wellness isn't just about medical. Wellness is about your state of mind, your comfort level with your financial wellness. So Prudential has a wonderful digital program that we have, actually you have a demo, right? Okay, at your table, that really will provide you personalized guidance, and it doesn't matter what state you're in, whether you are 25, whether you're 45, whether you're 75. It will help you look at your financial wellness in one-on-one coaching. I'm really kind of excited about this, and I went through it, and I think it's just a great resource to have. So the Prudential is out there, and they will be able to walk you through that and just kind of play around with that. It's kind of cool. So that's the AFSPA side, temporarily. One of my favorite things to talk about is the Senior Living Foundation. And before I get started into what we did last year, I want to thank those of you who allowed us to do it. The ones who believed in our mission and supported us through your generosity. You know who you are, and I want to personally thank you, because through you, we received $380,000 last year. 50,000 of that came from businesses, but we were able to give away a total of $450,000 in grants last year. And that is just amazing. Those people really needed our help with home health care, with assisted living, with medications, with immediate and emergency help, wheelchairs even, things like that. And you did this for us. You did this for them. These are your people. People ask me if I worry about the economy, if I worry about the stock market, and if I worry about whether we're going to get enough donations, and I just kind of smile, because you've never let us down. Foundation started in 1988, and this is, I think, the one charity that is yours, that you believe in, and I are forever grateful to you for your ongoing and continuous support of the Senior Living Foundation. With that, every other year, we host a Planning for Change. So this is a save the date. You're the first of many that I think you'll get. It will be September 24th. It will be here, I believe, held here again. And the topics will include things like medical and prescription issues for the seniors. And we're doing a panel on the senior move. management. When you are in that big house that you've been in for so many years and you've made the decision or you're thinking about leaving it because you can't take care of it anymore, it's too big for you, the steps are getting too big, that's a lot. And it's a lot emotionally. And then you have to think about the stuff like, well, what do I move? Who do I move? Who moves me? You know, all of this stuff. And then you think, oh, this is too much. I'll think about it next year. Well, let's think about it this year. So we've got a really good panel set up for you, not to mention the estate planning and updates from our partners at RET. Thank you very much, Sonia. I saw you. Thank you very much for your partnership and your support of us. And so you'll get a ton of information. It is a loaded afternoon, I know that, but I think you'll go away exhausted, but with a ton of information. So please save the date on that. All right, with that, I think I'm going to get the hook for temporarily, but I'll be back. Thank you.
All right, so we have, this is something we've done the last few years. We have a few demos that we want to provide to everybody. And the first, I'm coming out of the slideshow because we're going to do some live demos with fake accounts. The first is of the AFSPA Member Portal. So hopefully if you are an AFSPA member and you've managed one of your programs online, this screen that you're seeing is not unfamiliar to you. It is available at myafspa.org. You can go there, that will take you to this screen. There are also links on every page of our website. There's an upper right hand corner a link there. So I'm going to put in, again, this is a fake account, and as such the username is fake member. I will be putting in my password. All right, I got it right. So this is the screen that everyone should see when they first log in, and there's a number of different things that you can do inside the AFSPA Member Portal. Regardless of what plan you're enrolled in, or if you are not enrolled in any plans or just a member of the association, you can manage messages with staff members here in the upper left-hand corner of the screen. But the most important thing we find that all members can use is the member profile. So I'm going to scroll down just a little bit. And the member profile lists the information that we have for you. Your name, your address, phone number, email address, contact preferences, and so forth. And there is the opportunity here to update it. So as with many of our members who move every 2 to 3 years in some cases from one post to another, you can make those updates without having to call us. You can just go in here. And once you do, you'll see that the options come up. So if something changes with your salutation, you've got drop-down options. Your name will not change because that's come to us through enrollment materials, but you can update your address. You can update city, state, even your zip or postal code. And if you are overseas using a true foreign address, you can just put your postal code in instead of a zip code. And you can select your country, and all countries should be represented here. And there's also an option if you indicate that you have an APO, FPO, DPO address, etc., to change your country of residence. That's locked on this one because it's a United States mailing address. Email, it's always, I have to recommend this, if you are receiving AFSPA messages at your government or work address, we really got to encourage you to change it to a personal email address. We find that our emails, like many others, get caught in government filters quite often, and we're not able to reach you, whether it's with general information or specific outreach to you if you have an issue. So please update it to that, not Hotmail, Gmail, whatever your personal email provider is, please make that update. Home phone, work phone, etc. You can put in any information you'd like here. And then at the bottom, there's some good options here also for communication preferences. This fake member has theirs set to email. You can choose to go between email and mail depending on your preference, and also to opt out of mailings. There is an option for that here. And then there's also an option for those of you who are enrolled in the Foreign Service Benefit Plan. You may recall that back in 2011, we were required to stop sending you a copy of the big 120 plus page brochure every year because of part of a Going Green initiative. That said, you still have the option to receive a paper copy on an annual basis when we make those updates. You can select that preference here where it says, please mail me a paper copy of the brochure. You can also call us and we can make that update, but you're able to do that yourself here. There is an option here to change your login information. I'm not going to go into that because it does show you're in a secure area on our website, so it does actually show you your username and your password. One of the most used features on our website is the option to submit claims, and that for Foreign Service Benefit Plan members. You will have here on the right side of the screen a list of the different programs in which you're enrolled, and if you're enrolled in the Foreign Service Benefit Plan, it will always be the one on top. And one of the first options is secure forms, and underneath that is to submit a claim. You've got several different options to submit claims. If it's a simple claim, no questions, you would select claim without questions. If you want to put some additional information in there, or if you have some questions about the claim, you haven't spoken to anybody, but you want to put the questions in there, the middle option is the one you want to go with. Even if you want to just put some additional information, ongoing, this is a follow-up to a previous claim, etc., you have an option to put that in a comment box. Those are reviewed by human people in our office. It's not just going through the computer that way. So that will take maybe an extra day for it to be reviewed and then sent for processing. Now, if you've been on the phone or corresponding by email with one of our health benefit officers, you do have the option of submitting a claim to one of them directly, and you can go into that option if I click correctly, and you will see that there is an option here for to select your health benefit officer. I'm actually going to come out of this screen and just show you a simple submission, claim without questions, because this is the majority of claims we receive. So you come in here, and if you have if you have a self plus one or a self and family plan, you'll find that your dependents are listed here, and you can select that the claim you're submitting, which family member received the services. So in this case, we will say that it was the spouse who received it. And then we do have this option here, whether the claim was for the current year or the previous year. We'll say that this was actually a 2019 claim. And then one thing I want to note here, you have the option of entering the last four of your Social Security number, and we find that a lot of people do that. It's a number you're familiar with, easy to remember and put in there. Or to enter your W number. That is your ID number from your Foreign Service Benefit Plan card. Later this year, we will be making a change that it will only accept the W number. This is partly a security issue, but also when you put the Social Security number in there, it does slow the processing down because, again, a human has to go through, match that up, and put your ID number on there to put it into the system. So we're working on speeding that, getting the W numbers into the system so that it should auto-populate. But we will be making that change. You'll see some announcements coming in future newsletters, emails, as well as through our Facebook page. So I'm just going to put in a number here.
Social Security number for the member or for the wife? It was the wife, because your wife's Social Security number?
So the question was, if you are submitting a claim for a dependent, whose Social Security number would you put in there? You can put in the last four as you've designated that it's for a spouse or a dependent. You can put in that person's last four, but this is part of the reason why we're making the change to requiring the W number, because all family members will right now actually do share the same ID number. There's just a different suffix for each 01, 02, etc. for different family members. This is probably the most important part of submitting the claim. This is the box that allows you to input the diagnosis or the reason for visit. We do not expect you to put in the ICD-10 code. That we will take care of that on our end. But if you are overseas, for instance, and you go and you have an earache, you can put in that you went for an ear infection. If, as many of you both stateside and overseas, go for a massage claim, you can just put massage. Put that in here. That's enough information to help our claims processors know how to code the claim when they receive it. You've got an option then here to choose a file, and this will take you into your area. I just have a generic claim form here that I'll be uploading, but I want to also mention that we must have whatever you upload must be in a PDF format. We can't accept. At this time, we are working to make some changes so that we can change this, but at this time we can only accept PDF documents. And again, that's partly also for security for our system. And then the last piece here is a certification that everything that you're submitting is complete and accurate, and you must select yes on that. And then there's an option to scroll down just a bit, and then you can submit the claim. Okay, and then there is an option about to confirm that you did not enter your full Social Security number. We don't want that, just the last four. I'm clicking OK here. Oh, apparently not. Okay, and then you will see at the top there is a confirmation here that says your claim has been received and combined into a single PDF, because you do have the option of submitting multiple claims at the same time. They'll be combined into a single PDF, everything that you submitted, and it's now available for your reference in the My Claims section. So we can actually go down here and see 3/6/2020. Could click here, download the claim to make sure that all of the documents uploaded. And I encourage you to do that, because I've had situations before where someone meant to upload 17 pages and we got 2. And so they got very little in reimbursement when they were expecting quite a bit. So that's always a good step to take to verify that. And I'm not going to take questions right now. I'm happy to take questions afterward. And that goes for everyone who's doing the demonstrations. And I will be able to pull this up on my personal computer later. Other options that you have inside the member portal, I'm scrolling down through all these test claims we've done before. So every claim that you submitted through the member portal is available here for you to go back and reference in the future. You also can look at your information for other plans that you have through AFSPA, including here we have immediate benefit plan as an example, the disability plans, the GEL, that's our group enhanced life insurance plan. And there are options to get some information, to contact us, but also to enroll online. And that will take you to a secure form on our site to go through the enrollment process in many cases. And with that, one last thing I want to point out, and this is a great segue for our next demo, is that here under Foreign Service Benefit Plan, you also have an option here for FSBP-SSO, and that stands for Single Sign-On. So there are options here that you can click, and it will be a direct single sign-on, seamless handoff to either the Aetna Secure Member Portal, Secure Member website, or the Express Scripts Secure website, and we'll have demos of those coming up. You do have to, the first time you click this, you may have to log in and establish your credentials with each site, but by the second or third time, depending on the site, it should be seamless, but you will have to establish those credentials to begin with. Thank you all very much. I want to right now invite Britt Pirates forward. She's the Senior Account Manager for Federal Accounts from Aetna, and she's going to go through a demonstration of the Aetna Secure Member site. All right.
Thank you, Kyle. So as Paula mentioned, you guys have a lot of resources that are available to you online. And so I'm going to demo the resources that you have through the Aetna Secure Member Portal. And as Kyle said, you can get on there through the AFSPA Secure Portal through single sign-on. So once you get that single sign-on set up, when you get to your home page on the Aetna Member Portal, this is what the home page looks like. You have the option, if you need to view your member ID card, you can click here to view your coverage. If you need that WID number that Kyle mentioned, it's all right here. Also on the home page, you can check up through your deductible and out-of-pocket max to see what you've spent for the year. Then you also have access to your claim and spending. Now this is a demo, so there is no claim information, but this is where you would go and it would have the list of your claims. And then you could click on this link right here to pull up your explanation of benefits. Sometimes those can be confusing to members, so we have handouts over there about how to read your EOB. And like Kyle said, I'll be over there if you have any questions about the portal or your explanation of benefits. Another tab over here is the Stay Healthy tab. This you can get discounts for programs. This is where you would go for discounts like for the Global Fit, the gym, where you can get online videoing of gym workouts, the discounted memberships. I know we get questions about that. You also have a Stay Healthy tab, which I'll do that in a minute, that takes you to the member engagement portal, where that's where you can complete your HRA online and do different digital coaching to improve your health. We also have Discover a Healthier You, and this is a great tool. Let me go back, that went into the member health. This is called Health Decision Support from Emmy. If you get a diagnosis from your doctor and you get home and you're like, man, I had more questions that I should have asked, you can actually go in here and type in any health condition. So say you want to look at blood problems and you scroll down here and it gives you a list of different blood conditions. So say they talked about high cholesterol. You can click on this and view the program. I'll just do a short clip of this, but it goes through as a self-paced program. You can stop it at any time. You can take notes as you're going through it. You can print those notes, take them to your doctor to discuss with them. But I'll just do a short little clip of this. And this is the notes section where you can sit and start clicking on the notes to type as you go through this. And like I said, you can pause at any time and go back to it. This next is if you just click on the Discover a Healthier You, this takes you to the member engagement portal. This is where you earn your wellness incentives, and it tracks them at the top. You can see right here, there's a level and hearts and your rewards for the money that you've earned. You can click right here to step 1 of earning your health risk assessment. You can do this online if you prefer, but if you'd like to speak to someone too, we have the Trestle Tree coaches that are available as well. And then that will feed into the Aetna system and you'll still earn your incentive that way. This also lets you look at your biometric screening, any healthy action reward that you take. You also have the option to do digital coaching through here. And this also feeds back to our Aetna and Touch Care Management program. So if you are speaking with a care manager, they can see and they can walk you through this as well. Connect fitness devices to keep up with your activity. And then there's also different other links that take you back to the other programs that Paula referenced earlier. You can also look at your coverage and benefits. If you want to see what your doctor's office, you can click on here. Tells you what the cost would be. It also, again, shows you if the deductible has been satisfied for sick visits. Another thing is finding the care. You can look for providers on here. You can also go out to the public site and look for providers, but if you're signed up for this, this is an option as well. Then we also have what we call a cancer support center. For different types of cancer, you can click on these. And whether it's you or maybe a family member or a friend, You can click through these different things as either the caregiver or as the patient. It gives you different resources that you can use. So that's an overview of the Aetna Member Portal. And like I said, I'll be here if you have any questions. Can we close this down, Kyle?
Okay. Thank you, Britt. And our last demo this morning will be of the Express Scripts site. And to lead us in that demo, we have Mirzad Arefi, who is the Senior Account Manager from Express Scripts. She's the one who coordinates and makes sure everything keeps going well, takes all those urgent calls from our office to make sure they keep going. So Mirzad, if you'd come up.
Thank you, Kyle. And good morning, everyone. My name is Mirzad Arefi, as Kyle mentioned, and I'm very excited to be here, and thank you for having me here. I was actually planning to show you a new redesign and enhanced ESI member website. However, we had some technical issues, so unfortunately, I cannot show that to you. So I'll be just showing you the current ESI website, and I'll just give you some hints of upcoming changes that you'll be seeing at the end of this month, actually. So if you're a registered member at ESI Member Portal, great. If you're not, please do register. You have tons of resources and tools available to you to manage your prescription benefit. So let me just log in here. Maybe I'm having some, okay, got it. Okay, it's not working, so let me see. All right, got it. So as a registered member, you just need to log in with your credential. You can use this credential for even mobile app as well. So once you have your credential, you can use either your computer, your laptop, your iPad, or mobile app. So I'm just going to log in. Again, this is a fake member. So as soon as you log in, it would bring you to this screen, which is the most frequent use functionalities. So most people like to know where their order status is, how to refill prescriptions. So it brings you immediately to this screen. And you can check the status of your order. If you had any prescription, you can just click on the view details to see where your prescription is. And you can take a look to see if your prescription is being shipped to you or not. You can take a look at your automatic refills. If you have any prescription, you can if you want to order any prescription, you can select add it to your cart and go through the prompt, do the checkout, and get your prescription filled. With the new redesign, everything would be an easy of 2 clicks on the system, and you can order your prescription and have it shipped to you. You can choose your method of payment, the shipping method, and it would be just so easy to do. On ESI member website, you have tons of information that you can select from. As Paula mentioned, we just recently added CVS Pharmacy to your Smart 90. So if you want to find a pharmacy close by, you can just simply click on find a pharmacy, put your zip code or the city you're in, and just locate a pharmacy. Again, since this is just a fake account, you may not see the list of all the pharmacies, but you can see Walgreens here that is showing it can dispense 3 months supplies. You may not see CVS. Again, this is just a fake account, so you may not see CVS. But if through your benefit, once you log in, you should be able to see Walgreens and CVS as your Smart 90 pharmacies. Another option that we encourage our membership to always use, if you have a new prescription, you can always price the medication to find the most cost-effective pharmacy to use. So you can put in any prescription here. I'm not sure. Let me just try using, so Acupril. If I'm on Acupril, I can just choose the 5 mg, click on continue, put in the number of pills that I'm taking a day. And this is a non-preferred drug, so I'm giving the reason as to why I need to take this prescription. You would get all the coverage alert. If the prescription needs prior authorization, you would see that message here as well. And it tells me how much my cost would be, whether using the home delivery, a Smart 90 pharmacy, or a non-Smart 90 pharmacy. And again, right now CVS is showing 30 days. Again, this is a dummy account. So if you're on your account, you should be seeing a Smart 90 CVS pharmacy.
Is the first one Express?
It is. The home delivery pharmacy is Express.
So Walgreens is significantly less?
That depends on, again, this is just a, okay, keep that in mind. This is just a dummy account. Usually this is not what you see on a real world.
Right, that's a real drug, isn't it?
It is, but again, I mean, this is just a dummy account.
These are not our benefits.
And this is, yeah, exactly. This is not your benefit. Again, these are not foreign service benefit plan. This is just a dummy account that is being created just for purposes.
Question, are the prices usually reasonably similar?
It is, absolutely. Your copay would be exact same thing at the CVS pharmacy, at Walgreens, and at home delivery pharmacy. So you would not see a different prices between the three entities.
And those would be the cheapest.
Absolutely. I mean, we always encourage you to take the 90-day supply if you're taking your maintenance medications. So you would get a 90-day supply prescription from your physician and then fill it either at home delivery, CVS, or Walgreens. And again, I'll be here and I can answer any questions you may have. Just again, keep that in mind that this is not a foreign service benefit plan that I'm using right now. So the prices that you see, don't be alarmed. The co-pays are the same between the.
Just kidding.
Let's, if we can, hold other questions till later so we can keep the program moving.
Sure. Other option is you can go to, again, to your order status, automatic refills. You have option to take a look at your benefit overview, download forms, the health resources, and you can manage your prescription benefit through the site. Again, I'll encourage you, if you use Express Scripts and you have a prescription, obviously benefit through foreign service, log in, register, because you have tons of resources available to you. You can, again, check price of medication, locate a pharmacy, and use our resources to help you manage your prescription benefit. All right.
Thank you, Ms. Oz.
Sure, thank you.
And again, both Britt and Mirzad will be available later, and I will be available as well to answer questions about any of these tools. But I want to invite Paula back up. We've got a few more slides before some questions and before what may be the main event for some of you in attendance, which is an update on Medicare.
Thank you. I'm back. I warned you, promised you. So thank you very much for the demos. I think that a lot of people really do take advantage of the information that is at their fingertips. So I encourage you to just play around with the websites. So let's talk about the theme. And as you know, we try to choose a theme that is pertinent to our membership every year or two. And when I look at all the stress that's happening, I really looked at this year, and I think that mental wellness is very important, especially with our membership. So the theme that we have chosen for 2020 and 2021 is mental wellness leads to better physical health, and it really does. So Lena Horne once said, "It's not the load that breaks you down, it's the way you carry it." So when I look at what we are doing to help you carry the load of just everyday life now. I can see there are so many things and support programs that we have and can be doing for our members. So over the next year or so, you're going to see really a lot of highlights on what can we do for you to help you carry that load. Our In Touch Care program, our one-on-one coaching programs, digital coaching programs, My Strength, the telehealth program, and the Able To program, which is really a program that is meant for people who are diagnosed with a chronic condition. 80% of the people who are, I'm sorry, I forgot to turn this on, which is why I'm getting back feed. First I forget to turn it off, then I forget to turn it on. All right, 80% of the people who have a serious chronic condition like diabetes or heart condition or high blood pressure are depressed. You know, and we can help. So you will really see a lot of programs around this theme of mental wellness. Notice I didn't say mental health. We want you to really concentrate on mental wellness that will lead to better physical health. The more mentally well you are, the better you feel. And the more you want to do things for your health. So being a partner with you is really our goal. We want to be partners in your health. We have tons of programs that we'll partner with you to help you meet those goals, whether there are coaching programs or In Touch Care programs, the expert support for those serious conditions that you might have, mental wellness again, there are ancillary programs, including the one that I really love, the dental insurance program. Are you happy now? And those solutions that are specific to a condition like Livongo or the pharmacy support or wellness programs that you can really develop those personal strategies that will help you, healthy actions and those wellness rewards, because we really do want to care for you worldwide, wherever you are. So with that, I want to close this out and go into a Q&A session. Now, this Q&A session actually is, I tried to take out some of the things that the people who are on the webinar asked me, because those who are here can grab me at any time afterwards. All I have to do is find these questions. All right, so this won't take up too much time, but I did want to address a couple of things. The first thing I want to address is the question, why isn't Silver Sneakers part of the plan? I think I'll stand behind the podium for this one. Okay, Silver Sneakers is not a gym membership. It is as much as it provides individuals with access to organized exercise. All right. Now, I have to admit that is a distinction without a difference for the purposes of determining whether this cost falls and constitutes a qualified medical expense under the IRS rules. So when I tell people, well, it doesn't qualify under the IRS rules, and they say, well, what does the IRS have to do with it? The IRS has to do everything with it, with our everyday life, right? So here's the thing. Under the Internal Revenue Code that either allows or does not allow a health plan like ours to provide a benefit, it specifically says, you cannot include membership dues in a gym, health club, or spa as a medical expense. Prohibits us from doing that. I try to get around this. I've talked to attorneys, I've talked to Aetna's attorneys, I've talked to our attorneys. I'm like, are you kidding me? No, they're not kidding me. So here's the thing. Given this exclusion, the monetary value of that benefit to you could be considered taxable income, your taxable income. not ours. And it would be on everybody over age 65, not just the ones who use it. So that could be a problem. So to my knowledge, no other plans under the FEHB program allow for gym memberships because it's taxable. That's why we have discount programs with Global Fit. Now, I know you've heard and you've seen the advertisements on Medicare Advantage plans offering silver sneakers, right? It's under it's a different type of plan. It's under a Medicare plan. It's a Medicare Part C plan that has different IRS rules. So unfortunately, as much as I would like to include silver sneakers into your health benefits, we are not able to. So the second thing that we can do is offer the gym memberships and or the discounts. Now these discounts are for definitely, yes, for many gyms in the area. There's tons of gyms, but they're also, you can get online videos, you can get discounts on equipment. There's a lot of things that you can do with the Global Fit program. And we are there to give you information about that. So that's the first one. Now I think I can kind of step over here because I don't see anybody with tomatoes. The next question is, what are you doing about surprise billing? So you've seen the ads about surprise billing. And here's what that is. When you use a network facility and you do everything right, you get it pre-certified, you go to an in-network hospital, you use an in-network surgeon, so you have done everything that we want you to do. And then all of a sudden you start getting these bills for the anesthesiologist, the pathologist that they use, the radiologist, all of those. We call them hairpin providers, not the ones you put in your hair. Hospitalists, anesthesiologists, intensivists, radiologists, pathologists, emergency room physicians, and neonatologists. Hairpin. That's how we remember them. You are not going to argue with the anesthesiologist when you're being wheeled into surgery. You're just going to say, oh, thank goodness you're here. So that being said, I will tell you what the Foreign Service Benefit Plan does. For years, we have paid those out-of-network providers. There's no incentive for them to play. You're going to need them no matter what. They kind of have a captive audience. We have paid them at the same coinsurance rate as our in-network providers, at the 90% rate. And we have done this for years. So this isn't a new concept to the Foreign Service Benefit Plan. You have the responsibility for your coinsurance, your deductibles, and your out-of-pocket expense up to, which is like 10% of our plan allowance, which may be lower than what the doctors are charging. In that case, now most providers will not balance bill you. They will write it off because they just don't have time to go back and forth. Some want to play hardball and they will try to balance bill you. Your explanation of benefits is going to read something like this. You do not have to pay this. Your plan covers expenses at the plan allowance in the area this service was rendered. Under your benefit plan, you are only responsible for any applicable copayment, coinsurance, or deductible. If your provider bills you an additional amount over that 10% that you would owe anyway, we want you to contact us. We want you to send the bill to us, and we will handle it. We will negotiate with the provider. Aetna is really good at that. We're probably pretty good at that too. In the event, however, that they still play hardball, we will make you whole. Okay, you are not going to be responsible for that surprise billing. Now that's the way the Foreign Service Benefit Plan has chosen to do it. For those of you who have another health plan, you need to ask them, because we all do it differently. But that's the way we have chosen to do this. There's no, I don't know the actual code. I just have the language. Britt might know the actual code. That I'm putting her on the spot, okay? So we encourage you really to contact us if you fall in that category, because we're here, again, we're here to help you. The next question is, why is the wellness program not for healthy members and is devoted to members with chronic conditions? Well, for those of you who are healthy and don't have the ones that we have, the conditions that we are really looking and helping you, the diabetes, the high blood pressure, congratulations, lucky you. However, I understand, and we have heard this issue before. So we are looking at making some changes in 2021 to our Living Well Together program. Now, here's what that's going to take. First of all, we have to come up with some ideas, and we're pretty good at that. So we've got some ideas that will modify the rewards to reward the healthier population that we have. Thank you very much for being so healthy. Then we have to take it to OPM. And it just depends on what OPM says, if they will let us put it in the plan or not. So more to come on that, but we are looking at it and we hear you. Couple more questions before he really gives me the hook. I'm getting there. Okay. Do I have time? Okay, good. Would some other pharmacies be less expensive than Express Scripts? Because you hear this, that, you know, I can get my generic medication at this pharmacy for $2. And we charge more than $2. So it does look good. So Express Scripts is our exclusive prescription benefit manager and has been since 1986. 1986. Now, it is true that what you hear, some pharmacies have this deal where you can get a certain category of generics for $2 or whatever it is, but not all generics. And not everybody takes those generics, and not everybody goes to that specific pharmacy. So we have to look globally, and we turn to Express Scripts not just to fill that prescription, although they do that pretty well. We turn to them to manage our prescription benefit, thus the name, Prescription Benefit Manager. We turn to them to support our members and provide them the benefits that they need for their prescriptions, whether it is a pharmacist, whether it is an entire expat team that is devoted to overseas, whether it is sending a nurse in to help the member who needs help with an infusion because they're on a specialty drug and they can't do it themselves. So there's a lot more to our relationship with Express Scripts than just providing that medication. We also turn to them to negotiate with manufacturers, and you've heard a lot of this on the news, primarily from the manufacturers about it. So, is that me? Okay, good. I'm thinking, I'm sorry, I didn't mean, yeah, I did mean that. All right, so as a federal health plan, every dime, every penny that Express Scripts negotiates in discounts and rebates comes right back to the health plan. That is in our contract with Express Scripts. So all of those rebates and all of those discounts come right back into your health plan and keeps your premium stable. That's what we use that for, is for premium stabilization. That amounted, those discounts and rebates in the last 2 years, in 2017 and 2018, amounted to over $50 million in savings. $50 million in savings. So I had our underwriters do a calculation. If we didn't have that savings, you know, your premium increase was all of 2.9% this year. That premium increase would have ranged anywhere from 13 to 43%. So I think we're going to stay with Express Scripts. Okay. The next one is one that I do get a lot, is I'll save that for the Medicare thing, is why is the foreign service benefit plan self+1 premium higher than family this year? I think I'll stand behind the podium again. Okay, so, okay, as you know, where is that? All right, here's our premium for this year. The self+1 is about $3 more than the self and family. And that looks odd to you, right? All right, so here's how we take care of the premium. And we're going through this whole exercise now, even though it's March and for next year. When we look at the premium, we look at the overall increase for all of the entire family, self+1, and self and family. We try to, unless there's a specific reason, we try to just even it out and look at just you and not try to divvy up and make the family higher so it looks better, so the self+1 can be in the middle. We take months and years of experience for claims. We look at medical trend. I look at the transplants we've had, all of that stuff. And that goes into our negotiation and calculation on how much premium this plan needs to keep your plan stable. Last year, for this year, it was only 2.9%. I didn't need any more. I didn't have to raise the family rate, even though it might have looked better, but it wasn't fair. So that's all done, and by May, August, the summer. OPM comes in and they do their weighting a little differently. They look at all the plans, the big plans, and they look at the different categories, self+1, and family. And then they provide a government contribution on a weighted formula. What happened with this year, and in actually the first year that the self+1 came into effect, is that the government contributed less money to the self+1 than they did to the family. What that did for us is that it raised the self+1 by a few dollars, but we're not going back. So that is how we look at premium. Now, two-party enrollments do not have to select two-party. If you are a husband and wife, spouse and spouse, an enrollee with one child, you can go to the self+family. And many of our members did that, and they saved a few dollars every month. There is no requirement. OPM has not required two-party families to get self+1. And I don't anticipate they're doing that. So that explains that. And the last one I want to talk about is the Medicare one, because I'm going to go right into the Medicare thing. So a gentleman wrote, are there any changes in the law that would necessitate taking out Medicare Part B, or is the Foreign Service Benefit Plan largely sufficient? Well, I think we're pretty sufficient, but I do not think at this point in time that there's any change in the law that would impact a go or no go with Medicare Part B. For the person who is looking at Medicare Part B, it's more a personal decision, and it really boils down to a couple of questions. How much risk are you willing to take in your health care as your health needs increase as you get older? And how much are you willing to pay to mitigate that risk? Okay, so that's really what it boils down to. Now, there's been a couple of things that have happened. A couple of years ago, there was this Postal Reform Act that happened. The HR 2382, which just passed by the House 2 weeks ago, repealed that need, the requirement that of all of the federal agencies, and in fact, all of private sector, the Postal Service is the only company, because they're independent, that is required to 100% fund all employee benefits. I don't know why. Okay, no private company does, but that's what they did. So HR 2382 came into play. It passed the House. It repealed that requirement. So there is still this thing, the Postal Service Health Benefits Program that was part of the Postal Reform Act 2 years ago or 3 years ago that just stagnated. And it's probably going to remain that. And because NARF is absolutely opposed to cutting out the Postal Service, because what that would have done is required all Postal Service retirees to purchase Medicare Part B, kind of like TRICARE does for the military sector. I don't really see that approach going any further, and I certainly don't see it happening to the FEHB. So in answer to the question about is there anything on the horizon that would want us to rush to take Medicare Part B, I'm just not seeing it. Again, it boils down to how much risk you're willing to take and how much are you willing to pay for that. Now, there are a few things that you may hear that are, there's 3 House bills that are not, that have not been passed. They're in their early stages. One is the Hearing Act, Medicare Dental Coverage Act, and Medicare Vision Act. See all these people around us? We have that. Your FEHB, you are a federal retiree. You know you have FEDVIP, the Federal Employees Dental and Vision Insurance Program. You also know you have us, along with several other employee-sponsored groups that sponsor excellent programs. This is an election year. I highly doubt if they're going to make this, if they're going to make this one of their issues. So I don't see that happening. And it may be fine for Medicare, but you're Fed and you already have it, and you have had it for many, many years. So those are the questions that I have had from our colleagues who are on the webinar. Thank you very much, and I hope that I've answered some of the major questions. Now with that, I want to go through a brief update on what has happened with the 2020 Medicare program and the Foreign Service Benefit Plan. And no, you don't have to sit through my whole class that I give at the retirement planning seminar, but I do want to give you some of the highlights. First off is, as you know, Medicare does not cover anything overseas. So if you do not have Medicare, you have the FEHB, the Foreign Service Benefit Plan, or any of the other fee-for-service plans, you're covered overseas because we've got your back. We always have. If you do have Medicare Part B and you are traveling overseas and something happens that you need medical care or hospital care, you're covered by your FEHB plan, right? You're covered under the Foreign Service Benefit Plan or any other plan. But that means that you can't file your claim with Medicare because Medicare doesn't pay overseas. You have to file with us, or if you have another FEHB plan, okay? Medicare Part A, as you know, is inpatient hospital care. It is not observation care. Medicare Part A covers inpatient hospital care. It covers hospice care, and it covers very limited inpatient care for skilled nursing. If you go to the hospital in the middle of the night on an emergency basis, and they say, we're going to do some observation, we're going to watch you, we want to give you an MRI, we're going to hook you up to an IV, and we're going to put you in a room, and you think you are inpatient, right? You're not. You are outpatient. You are under what they call observation care, and that is covered as a medical expense. Now here's what might happen in that circumstance. The administrator will look at it and say, oh, they don't have Medicare Part B. Let me run before we put too much money into this patient and tell them, you don't have Medicare Part B, you're not covered for this. Well, when you finally get off the floor and back to your bed, you will realize that you're fed. you have the Foreign Service Benefit Plan or another FEHB plan, and they will cover you. That is where the observation care falls. We cannot change, as much as we would like to, we cannot change the way the hospital bills us. If the hospital bills us for observation care, that is exactly how we are required by law to pay it. Even though we know you're kind of inpatient. So, but this is what your Medicare Part A coverage is. Now, yes, ma'am. Pardon me? So okay, so if you have Medicare Part A, I mean, they would cover you under Medicare Part A, and I would assume that they would quarantine you. Any hospital would. Your federal health plan will pay the deductible, which is this year, I think it's $1,408 or something. Your health plan would cover you, so you are 100% covered under that. I cannot imagine any hospital billing for observation care on a quarantine patient. Okay, so let's talk about Medicare Part B, because that's where the rub comes. Medicare Part B is means tested, which means that your premium is based on your modified adjusted gross income from 2 years ago. All right, what could that mean for you? It could mean a lot for you. For 2020 Medicare Part B premium, they have changed it a bit. This is a 2-year look back, which means that your 2020 monthly Medicare Part B premium is based on your 2018 tax statement. Okay, and this is hefty. The base for Medicare Part B premium for this year is $144.60. But if your adjusted gross income line from 2018, if you are married and filing jointly and it's $218,000, you're going to pay $289.20 a month per person for Medicare Part B. Medicare Part B does not have family coverage. All right, so this is where I say, you know, two things. Depends on how much risk you're willing to take, and it depends on how much you're willing to pay for mitigating that risk. So it's an individual decision, but understand that this happens every single year. Your 2021 Medicare Part B premium is going to be based on your 2019 tax statement. So do the math. That's all I can say. Now, Part B services are doctor's services, outpatient hospital services, home health care servicing, your durable medical equipment, kidney dialysis. That is all covered under Medicare Part B. And your Medicare Part B out-of-pocket expense for 2020 is $198 deductible, and then you're expected to pay 20% of the Medicare approved amount, and there may be extra billing for those non-participating physicians. Your Foreign Service Benefit Plan covers that as well. All plans are different. If you don't have the Foreign Service Benefit Plan, make sure you look at whatever plan you have and see what they cover under for your extra billing for non-participating physicians. Let's talk about these physicians, because this is really important. If you have Medicare Part B, how many people in this room have Medicare Part B? Okay, those of you who raised your hand, pay attention. Those of you who did not, take a nap. Okay. If you're retired over age 65 and you have one of the fee-for-service plans like Blue Cross, US, Foreign Service Benefit Plan, GEHA, whatever, you go to a doctor that accepts Medicare assignment. They're called participating providers. The provider will treat you, will bill Medicare, and they agree to charge you only what Medicare says is the approved amount. He or she may want to charge you $200. He will only be able to charge you $80 or whatever the Medicare approved amount is. Medicare will pay 80% of that. your health plan will pay 20% of that. You're golden. It's risk mitigation. The second type of physician is what they call the non-participating provider. And these are the providers that they do participate in the Medicare program, but they do not have to take what Medicare says is the approved amount. They can charge more, but there's a limit to what they can charge. That's the name, limiting charge. About 15% more. Okay, so they file the claim with Medicare. Medicare pays up to their approved amount. Your health plan will pay up to the approved amount. Some health plans will pay that extra amount. Your foreign service plan will. You'd have to check with the other plans. All right. So you're golden again. Make sure you understand what type of physician you have. And I'm not talking whether they're a cardiologist or a lung doctor or whatever. It's how they participate in the Medicare program. The third type of physician are what we call opt-out providers. We don't like them very much. They don't play nice in the sandbox. They have decided, for whatever reason, valid or not, that they will not participate in any way with the Medicare program. And you have to sign that you understand this. And that you understand that they will charge you whatever they want to charge you, right? You can't file a claim with Medicare because Medicare won't even acknowledge them. Right? You can file a claim with us or your whatever FEHB program you have, but because you have Medicare Part B, we can only pay what we would have paid had you gone to a Medicare doctor, which means 20%. We cannot pay any more. It's the law. Doctor may be the greatest doctor in the world, maybe your only doctor that you want to go to, and that's fine. And you will get some benefit from being part of the Federal Employees Health Benefits Program, but it's about 20%. So those are the three types of doctors. And what you really need to think about is, does your favorite doctor take Medicare, right? Because if that doctor is one of the first two, then you're okay. If he or she is an opt-out doctor, then you're not so much okay, right? So another big decision to make about that. Okay, so for those of you who do not have Medicare Part B, you can wake up now. And I want to talk to you about what happens to you. Nothing changes, nothing has changed in the FEHB program since last year. Everything remains the same. All right? You as a federal retiree are not required to take Medicare Part B. It is voluntary unless you have TRICARE, and then it is required. So you get the same benefits as before. You get to pay the same premium as before. The government continues to pay its share of your premium. And because you're a Fed, there is a law out there. It's 890.905 that limits your liability in certain respects. By law, your health plan, your federal health plan must limit our payment for inpatient care and physician care to those payments that you would be entitled to had you had Medicare. And your physician, those first two types of physicians, your Medicare participating physicians and your Medicare non-participating physicians and the hospital can't bill you for any more because it's a federal program. Now, you're responsible for your deductibles and your co-pays and your co-insurance the same way you were when you're active duty, right? So again, nothing changes. And to a certain extent, you're protected. Now, those opt-out doctors, the ones that don't play nice in the sandbox, they don't play nice in this sandbox either. They're not liable, they don't have to follow this law. So they can charge whatever they want to charge. There's no limit, except Just because these doctors do not participate in the Medicare program does not mean that they don't participate in your health plans program. Most of the doctors will participate in Aetna, Blue Cross, GEHA, whatever they have, whatever you have. So you get those negotiated discounts that you have received while you were active duty. So again, nothing changes. All of that in-network discounts still apply. So you still have protection. Now, this is as clear as mud, and I understand that, which is why we've invited Larry Neufeld back. Welcome back, Larry. He is our Medicare expert. He will be happy to walk you through the specific questions, but I just wanted to give you an update of what's going on. We just hot off the press got a new Putting It Together pamphlet that has how Medicare and the Foreign Service Benefit Plan work together, and then what happens if you don't have Medicare program. If you do not have the Foreign Service Benefit Plan, I would recommend you go on your other health plan's website, and they should have something similar to ours. All right? So with that, I want to thank you for coming out. I know that a lot of people did not. You may have decided to come at the last minute. I really appreciate it. For those of you who are on the webinar, thank you so much for sitting in with us. We appreciate your concern and your commitment. And now this will close out this program, and now we will turn it back to Kyle, and he'll talk about the mini health fair that I really want you to stay with for and talk to our excellent partners in your health. Thank you very much.